Hey gang, welcome to another episode of the Rotator Cuff Expert. I'm Dr. Daniel Orcutt. I am a board-certified orthopedic surgeon. Someday we'll talk about what that actually means, but because of the channel, I have lots of people reaching out to me, people reaching out about sending their MRI results to me and saying, hey, can you look at this, tell me what you think? And I do want to be helpful, but there's a reason why you need to go see a doctor. The reason why you need to have someone talk with you. There's a reason why that's necessary before you would sign up for surgery. And so I thought I'd go through this quickly. There's actually four things that we look at in trying to make decisions of whether we have to do surgery on someone's shoulder. First, the history. Second, the physical exam. Third, the imaging. And the fourth is probably the most important part. And I'll get to the fourth part at the very end. So what's the story? How'd you injure yourself? Did you injure yourself or did you just start hurting? Because that kind of gives us a good kind of baseline. Also, we get to know the person and the person gets to know the surgeon. There are certain injuries that happen when you're younger and certain injuries that happen when you're older, but they can cross as well. And so we want to know the history of what happened. The second we want is the physical exam, right? So we want to actually look at the patient and then touch the patient and move the arm around, move the shoulder around. We want to determine what are the symptoms that you're having. You describe I have pain, and then whether we can recreate that problem. There are certain maneuvers that we do that tell us, oh, it's this, not that. Oh, it's the biceps, not the rotator cuff. Or it's the front of the rotator cuff, not the back of the rotator cuff. Or maybe it's the biceps or the labrum. Because then we go to the next one, the imaging. So you're going to get x-rays and almost always before we have surgery on the shoulder, we're going to get an MRI. And the biggest problem with the MRI is it tells us a whole bunch of stuff. And some of the stuff is important and some of the stuff is not important, right? And that's really, the stuff that's not important is important for us to know. Well, what do you mean? Well, if we get an MRI, it shows you have a torn labrum. Most of us, I'm 55, most of us over the age of 40 are going to have some degeneration of the labrum. As you recall, the labrum is stuff that goes around the socket, right? And if we have the labrum tear, it may have nothing to do with what our symptoms are. Another really classic one is arthritis at the AC joint up here. Almost everybody who is older has arthritis at the AC joint. That oftentimes is not painful at all, and we should not do anything about it, even if the x-rays show arthritis at the AC joint, even if the MRI shows arthritis at the AC joint. If you have no pain at the AC joint, we should just leave that alone because that's not causing the problem. So imaging is important, but we have to have the imaging in the context of the history and the physical exam. That's why when I get an MRI for someone, I can't possibly, probably it's malpractice as well, but I can't possibly tell you this is what you should do because there's no way to know without having all the history. And the last part is super important is who are you? What do you want? What do you want to do? What would you like? And can we match that realistically with what we can do? If you're 95 years old and you have a small rotator cuff tear and you come in because it hurt some and now it doesn't hurt anymore, we know the history of, you're older and no specific injury. Exam is not very impressive. It's okay, but it doesn't bother you that much. Your imaging shows a small rotator cuff tear, or maybe it shows a big rotator cuff tear, but you're not having much trouble and you're 95 years old. And that really changes our opinion of what to do because we need to know the whole context. Or let's say you're 30-year-old and you have an arthritic shoulder and we can see that you played baseball a lot. Exam consistent with the arthritic shoulder and the imaging shows arthritic shoulder and it doesn't show much with the MRI of the rotator cuff looks okay. It's just the arthritis. And then we go, okay, well, what do you want to do? Do you want to continue to play baseball in your 30s in an adult league? Well, that might not be possible. Do you want to relieve the pain and understand that it's going to limit you if we do a shoulder replacement? So we really need all four of these together. They fit all together. And now our plan is, if injection doesn't work, if therapy doesn't work, if medicine doesn't work, if time doesn't work, then we kind of have a plan of what we're going to do next. But we need all four of these to come together. So anyway, I hope this helps. Please like the channel. Please subscribe to the channel. Please leave any comments. I answer all the comments. Well, almost all. Some of the comments I actually can't answer because they're not appropriate. But anyway, that's beside the point. Anyway, so I hope this helps and we'll talk to you soon.